Well, given all the notes I made, I'm not sure how much justice I'm going to do to the various presenters, but I'll try. We had 3 presentations, and in the very first presentation, Michael addressed the issues of timing, especially in relation to the kinds of relationships that exist among environmental and the environment, brain development, and behavior. And in that process, also spoke to the issue of coordinating the timing of interventions with the timing of critical or sensitive periods in brain development. So that was one of the central key issues. Oops. Now, one of the things I noted was the appearance of some kind of a tension around implications of what we know about early development, especially developmental neuroplasticity, for the kinds of interventions that we invest in. So there is a temptation in some discipline-specific inquiry to emphasize intervention in the earliest years of life. And Michael underscored that while it is better to intervene early, interventions later in life are equally important, or maybe also important, okay, if not equally. I'm going to pick up a few things from Maureen's presentation. And Maureen began by addressing the issue of exclusion of children with disabilities in conversations and policies and actually programs on interventions for young children birth to 8. And she examined various explanations for why this is the case. And she spoke to the paradox of global attention to child survival and along with minimal attention to children with disabilities, because as she sees it, as survival increases, disability also increases. As we overcome the problems of survival, we tend to have more and more disability. So one would have thought that just the juxtaposition of these 2 facts alone should drive us to look as equally to children with disabilities as we do with typically developing children. Now, one of the areas I wish we had time to talk about is what I consider to be her review of, in my mind, the potentially paradigm-shifting orientation to the definition and intervention within the international classification of disability, impairment, and health. Classification of health, impairment, and disability. Because one of the things you get from that framework is it takes us away from diagnosis and categorization and classification and onto issues of functionality and the role of society in what passes for disability and the limitations that accompany disability. It's unfortunate in my mind that actually this framework has not been accepted in the United States as it has in other parts of the world. So I think that's something we need to think about in the future. And very quickly, as I time myself in the 3 minutes, I'm going to pick up a few issues from Robert's presentation. Robert directed the core of his contribution to what he saw as critical knowledge gaps in our knowledge base for a science of developmental potential. He reviewed characteristics of human children that make it imperative for us to take seriously matters of context and child-level agency in children's shaping of their own life journeys, as he put it. Now, one interpretation I make of Robert's point is that we need to juxtapose and assess the relative significance of conventional biology-driven conceptions of developmental trajectories and the conceptualization of development also around the agentic contributions that children make to the navigation of their own lives across contexts that are imbued with both adversity and opportunity. So in a way, Robert interrogated the logic underlying the way we think about developmental interventions. Metaphors of intervention that work well for outcomes pertaining to the advancement of child survival, growth, and health might not actually work well for interventions directed at outcomes that are layered in variations in context and values. And so in many ways, and I'm going to cut this short, in an era faced with the challenge of finding universal principles to guide population-level interventions, something that is very, very critical, Robert opened up a conversation on factors that make it difficult to specify such universal principles of human development. And I think by so doing, he's probably challenged us to think of different ways of getting at our problem. Thank you.
Okay. my panel is really giving us a kind of a snapshot of the situation around the world at this point for young children. Don started things off talking about child development and with emphasis on the age and stage specificity for the intervention. Of course, the integration across sectors being important. Have to think in terms of health, education, social protection, nutrition, and so on as an integrated whole. The role of the caregiver, multi-generation support, and how there's kind of a disparity in terms of a burden on women of childbearing age and adolescent girls primarily. And of course, disabilities, differences between physical and cognitive, behavioral, and the lack of data, so we don't know the scale and of the challenge, and because of stigma and popularity issue, the invisibility of the issue, so encourage us to rethink this particular challenge. Parfait took a different perspective on the growing on the issue of inequality, which obviously was still also ran through Don's presentation as well as all the other speakers' presentations. And the theme is really growing up global and unequal, and could be driven by and the inequality could be in the sense of between countries, within countries, and within families. A lot of it driven by demographic changes, things like mass social media, and as well as available resources versus needs. But he sees opportunities in the MDGs, the development from a life course perspective, the issue of the emergence of a country, as well as demographic dividends, but he encouraged all of us to act now instead of waiting further because of the potential to influence future generations. Mickey talked about the reiterated theme of dramatic decrease in child mortality globally, but he cautioned us to make sure that we dig deeper into statistics. So for example, in some sub-Saharan countries, while the rate of child mortality decreased, the actual overall death has actually increased because of population growth. And another example he cited is Nigeria, where even though there's some education available, in rural areas, it's still largely, the population still largely do not have access to these opportunities. Sorry. And alluding to the presentation that Atif gave later on, the issue of untapped talent pools. Mike also talked about community health workers, about 14,000 village health workers that may be available to help address some of these challenges that we're facing, especially in low resource settings. They soon talked about the situation in the Arab world, how there's more, obviously there's more demand than capacity, complex needs of the family, and the fragmented services and delivery, and of course, unique threats from conflicts and emergencies. I think she cited many examples that to me seem to suggest that economic development doesn't always translate to greater equality for the population. The fact that many of the programs available for pre-primary education are uneven, and most of it is in private hands, I think speaks to that issue. Of course, the significance of conflict and emergency, its impact on early childhood development, because of the issue relative to safety, injuries, displacement, and so on. And the education and social needs are not really a priority for most aid organizations. The recommendations of prioritizing ECCE in all situations, greater attention to 68, and of course, we need more information database and research, especially for the marginalized population, such as children with special needs and those in more rural communities. So to me, the themes that really emerged from the panel is really the inequality driven by demographic changes, historical neglect, a lack of awareness, and that is not always addressed with economic development. Of course, Zolfi encouraged us to rethink the inequality issue beyond the more traditional socioeconomic parameters, but also think about things like ethnicity and geography that may play a role. The role of caregiver and caregiver support is certainly significant for both from our session as well as the most recent panel, and they may actually in many ways offer a possible solution for us. And of course, the lack of data in general on the marginalized is a major challenge. But I guess the question begged to be asked is that because we don't have the data, does that mean that there's no obligation to act? And if there are obligations to act, what do we do? What is the right thing to do? And finally, I guess, especially with developmental disability such as autism and other mental health issues, I certainly would like to hear more about the role of stigma, for example, as a barrier for resolving these challenges.
Thank you. Well, I want to start by thanking the presenters in the panel around measurement. I think if we would retitle it, it would be Measurement to Action, which is one of the themes that I think we heard throughout that panel. But it was pretty exciting to see the work that's going on across the UN agencies, and to know that, and I know from many conversations on the outside of this room, that they are really trying very hard to work together, and that's always a challenge. I also know that we could have had any number of countries here to talk about what they're doing on measurement, and we need to recognize that. But, you know, I think we got a very good sense from Claudia about the range of wonderful data coming out of UNICEF and the importance of us putting it to use. And that example that she gave of the data leading to a change in policy in one country, I think was particularly exciting. I think to hear WHO talk about the importance of 0 to 3 in their work, to start to look at indicators of development for children under 3, which we've all been waiting for, which is the way we get beyond just, you know, beyond survival, is very exciting. And Patricia's addition of the context that we need to look at, family context in that way. And then, of course, the work that UNESCO is doing with Brookings and UNICEF to really look at both the quality of classroom environments and how children are developing in the 4 to 6-year-old range. I personally think all of that is related to learning birth through 5. But rather than summarizing their presentations, I want to make 3 points. And one is about a dashboard, a data dashboard. One is about harmonization, and one is about disaggregation of data. First, someone said this to me on the break. They said, at the end of that presentation, I kept thinking, if I was in a country and I was a minister and I said to all of the panelists, I want to do a data dashboard, tell me the 6 things that I should be tracking, could we give them an answer? And I thought it was a really good comment. I wanted to share it with you because we should keep that picture in front of us, because that's really where we have to take this. And so think about that data dashboard. Second theme, I think, that came out was the need for harmonization. And I think the need for harmonization in at least 4 ways, and I'm sure I missed them. One was around health and education, so really harmonizing horizontally. Children don't come in pieces, their health and education's integrated, so we've got to integrate the data. Secondly, vertical harmonization and integration, that children develop in a pathway. We have a life course perspective. So how do we link the data, both at the population level and at the child level, across the lifespan, and what does that mean as we try to figure out what is impacting on development? Third, all around harmonization, is the harmonization of the global measures with the national measures. And I think that's going to be really a challenge as we move forward and as countries move on their own to develop measurement and tracking. And then I guess fourth, this whole notion that we're looking at child outcomes, we're looking at context, including culture, and we're looking at policy. And how do we harmonize that picture? So harmonization across at least 4 variables, and I'm sure there are more, is an important theme. So dashboard, harmonization, and something that didn't come up that I wanted to just raise, and that's the disaggregation of data around things like poverty. We know that if we look at the poverty data, if we look at it by age of child, that the poorer you are, the younger you are, the poorer you are. And we really need to be looking beneath these global data sets at what are the conditions for young children. What does the data tell us about young children, since they're the most vulnerable? The same thing with rural-urban, the differences in the rural-urban, the differences of development by income, the inequality pieces that came up. But we need to be looking, disaggregating these national databases, these global databases, and figuring out what are they really telling us about the most marginalized populations. So we need a data dashboard, we need to harmonize, and we need to disaggregate.
it's a great reminder of what the fourth panel touched on, because the fourth panel spent quite a bit of time on poverty and its interaction with caregivers. And I'm going to sort of do what Joan did and summarize somewhat. I think that Amina caught the gist of many of the conclusions, which was that children's developmental potential can't be realized unless caregivers' conditions are adequately met. That's the bottom line. And all of the presentations also reinforced that poverty probably has an independent effect on child development, but it also interacts with caregiver conditions. And I think that came through quite clearly in several of the presentations. Atif started by busting the myth that the prevalence of maternal depression is not high. It is high, and that maternal depression impacts quite directly on child development, and that it is difficult and expensive to improve. And then Amina reinforced the multiple pathways to developmental challenges and the interactive effect of context and poverty with caregiver conditions. And then we jumped into conditional cash transfers, minimum wage, and I thought what was interesting about that presentation was it was a reminder that this is rather new in terms of interventions that we're looking at for child development, and consequently there are lots of unintended consequences popping up. There are lots of questions that can't be answered yet, and conflicting results of various approximations of randomized control trials. So we're all going to be waiting with somewhat bated breath to see what that mix of poverty interventions and caregiver and child interventions and engagement will yield for child development. And then I'd just like to point out sort of a theme that I think I heard in some of the other, in the harmonization and in some of the other panels as well, that I believe was implicit in the fourth panel, and that was the challenge of integration. The fourth panel in particular, looking at caregivers and at poverty, was beginning to address arenas where there's no clear sectoral ownership. So you have, in a sense, I mean, poverty is impacted by so many different programs and policies. And similarly, maternal depression, well, where does it fit? Somebody said mental health doesn't really have a home. That's true. So we're up against these challenges of figuring out how do you provide holistic services, as Amina called for, and as we see in these sort of crisis responses, perhaps to HIV at limited scale. How do you integrate both policies and services so that they really can impact in a relatively cost-effective way the complexity of children around the world realizing their development? Add to that the complexities of actually implementing policies and programs, and we've got quite a conundrum to deal with, but it's something that I hope we think about in the next couple of days.